Obviously, the boys don't have seasons, but they do have hormonal shifts as they reach adolescence and go through puberty. Anywhere from 6 months of age, changes can be noticed in both males and females, such as behavioural shifts like ignoring your commands, breaking house training, being scared of things that didn't bother them, or being more confident about things that did. Humping before 6 or 7 months of age in our males, and sometimes our females, is non-sexual play, but may have a more sexual connotation once they hit puberty. Along with sexual arousal and humping comes the presence of the bulbus glandis. These glands sit at the base of the penis and are present as 2 swellings either side in an aroused dog. It can look alarming, and if you haven't noticed it before, you may feel there is a medical issue. However, the swellings will reduce once the dog is no longer aroused. So one problem that can arise in our sexually aroused males is paraphimosis, and that basically means the willy is stuck out. I just want you to have a couple of tips of what you're going to do in that situation, because it can look really alarming. When the willy comes out, the longer that it's out for, the more swollen it's going to become. So a good tip is to make up a sugar water solution. So you might have to dissolve the sugar in hot water, and obviously make sure it's cooled right down before you then dunk your dog's willy in it. And the idea of doing that and surrounding the willy in lots of sugary solution is to try and reduce the swelling. So that's the first thing that you can try and do. And the second thing, you might want to put on a pair of gloves for this, is to try and encourage the willy back into its sheath. So you might want to use a bit of lubrication, something like Vaseline. But it can become an emergency if it's out for too long. So, 20 minutes or so. If you've got a long drive to the vets, then you might say to yourself, oh, I've got an hour's drive, I'm not going to leave this long at all. But give it 20 minutes, half an hour if you haven't got too far to go, and see whether it can reduce in size and go back in, and 9 times out of 10 it will. The other thing to note as well about our young males, especially during their younger years, but this can carry on throughout their whole lifetime if they are left entire, so without having their testicles removed, is a lot of smegma from their willy that can be quite profuse, and it can look quite green or yellow in colour, and for some dogs can be actually quite alarming the amount they produce. So some people actually choose to castrate to reduce all of that production, especially if we've got young children and things, and this is all kind of being splashed around, spread around the house. It sounds dreadful. You've got children perhaps that are young and crawling, etc. So maybe for hygiene reasons. So they're just things to think about in our males, especially those that are left entire. And just one final note, paraphimosis, so with the penis stuck out, that can happen in males that have been neutered also. A dog's testicles begin to descend and move into the scrotum from 1 month of age, and are usually in the scrotum by 3 months of age. For some dogs, this process may be delayed by up to 12 months. But for some males, their testicles never move into the scrotum, and they are described as being cryptorchid. There is a huge risk of testicular cancer developing if a testicle or testicles don't move into the scrotum, as they sit inside the body instead of outside in the scrotum. The conditions are far too hot for them inside the body, and the risk is changes to the growth of cells, leading to cancerous changes. So this kind of leads on to, should we spay or castrate all dogs? They are so individual. I don't think we could ever make a blanket statement like that. I think there are certain scenarios, like our cryptorchid dogs, where either one or both testicles have not moved down into the scrotum, where, yes, we should definitely be considering castrating those guys. Now, the issue is if we say just remove the testicle that hasn't dropped and keep the testicle there that has, what about if that person goes on and breeds from that dog? They're now going to potentially spread that condition that's affected that dog onto another litter. So morally, we should be castrating them completely, removing both testicles. But let's look at neutering a little more. First thing to say is my opinion as a vet. Neutering is not the answer to behavioural problems. That is why behaviourists exist. If you tell me your dog is boisterous, my scalpel and surgery is unlikely to fix the issue. In fact, in nervous dogs, it's likely to make the issue a lot worse. Take an anxious male who is wary of other dogs, castrate him, take away his testosterone, and he may become aggressive to others to protect himself. We cannot go back once we've done this surgery. Do remember, adolescent males have more testosterone than adult males, so they will calm down as they mature. It's around about this time now that most people feel frustrated by their dogs when they're going through puberty, and that's often when they end up in rehoming centres. This is the time now that you need to invest, be patient, ask for help from a behaviourist, and realise this time will pass. One option for male dogs is to trial an implant known as a chemical castration before committing to surgery, if you'd like to see how your dog may react if they were to be surgically castrated. Supralorin is one such implant, and it won't completely mimic the effects of castration, but may give a very good idea. It remains in the system for either 12 or 6 months, depending on the implant size used. Dogs must be sexually mature before it's used, so at least 6 months of age, usually older. Testicle size is hugely reduced when it's given, which is a sign that it's working. It doesn't require removal as it dissolves over time, and it can be injected into your dog at a normal vet consult and looks similar to a microchip. So taking castration, or indeed spaying, into consideration, when or should it be carried out in your dog? For castration, there are lots of things to consider. If you don't castrate, there is a risk of testicular cancer later in life, prostatic hyperplasia, so enlargement of the prostate, social problems, as in dog boarders and daycare may not take them, so restricting your lifestyle. Entire male dogs may cock their leg and scent mark in unwanted places, and unwanted litters if he encounters a bitch who is in season. But what are the cons for taking the testicles away and castrating? Castrated dogs can get prostatic cancer, and prostatic cancer is not particularly common, but it's incredibly rare in entire dogs, those that do have their testicles. It's much more a condition of dogs who have been castrated. Some breeds, both male and female, will be at a higher risk of certain cancers like lymphoma and hemangiosarcoma, both highly aggressive cancers if they're neutered before a certain time frame. Castrated and spayed dogs can also suffer with more debilitating joint disease, usually for the larger breeds, again if neutered too early. One study claims that German Shepherds and Golden Retrievers neutered before 12 months old, so this is for both male and female, gave them up to a 4 times more chance of suffering with joint disease and 4 times the chance of suffering with certain cancers. One fantastic resource for you is the website above or in this slide, which is Frontiers in Veterinary Science, looking at the risks of neutering at different ages for different breeds. This is for the girls and boys. And basically it's not to say do not neuter, it's about getting the timing right and being aware of the risks when choosing to neuter or not to neuter.